Hello, everybody. My name is Jeremy Shaba, and I'm a vet student at the Ontario Veterinary College. And I'm here today with Dr. Sarah Cates, a 2013 Ohio State University graduate. Welcome.
Hi, thanks.
And she's also the current intern at Wisconsin Equine Clinic in Oconomowoc, Wisconsin.
That's
And
right. Good
yeah,
pronunciation.
so I thought we could start off and you could tell us a little bit about the internship.
Sure. Our practice is a pretty big 12 doctor practice, 13 including myself. And right now I am the only intern. And so pretty much the way that the internship is set up is I'm based in the hospital, and we have three surgeons, one of who is a new hire, and he's actually taking his surgical boards this week, so he's gone for the time being. But we have three surgeons, and those are predominantly who I work with. I'm in the hospital. I do lameness exams and in clinics, including any type of like endoscopy, gastroscopy, etc. And then I also admit emergencies with them, and I assist in surgery and do anesthesia. And then we also have a variety of field ambulatory practitioners, and they also see some appointments in the hospital as well. So I work with those doctors also and kind of rotate through. And then during the slower time of year, so this fall and then into the winter, I also go out on the road with them. And so I'm out on the road maybe one day a week, sometimes more, like 2 days a week, depending on what the schedule's like.
And if there are field emergencies, do you go out to those, or who sees the field after hours emergencies?
So 2 days a week during the slow period, I'm actually on backup call 2 nights a week. And so I can go out and see those. And then depending on what the caseload is in the hospital, they're really good about letting me pick and choose what I want to do, what's going to better suit me later on. And so, for example, the other day we had a lameness in clinic, and then there was also a really bad laceration out in the field. And so I told them I want to go on that call. And so I was able to go, which was probably not a wise decision because it was -40 wind chill that day.
And
So yeah, they let me kind of choose.
And when you're in the hospital, do you rotate through like anesthesia, surgery, lameness, or do you just kind of go wherever they need you?
It's a little bit of both. And like I said, they're really good about if there's something that I want to see, they let me for sure scrub into surgery.
Hmm.
I'm on call for anesthesia at night. And so the nights I'm on call for that, I definitely do anesthesia. During the day, one of the technicians is trained in anesthesia. So she's more likely to do anesthesia during the day, and I scrub into surgery, depending on what it is. And especially if they need help, I usually will scrub in as well.
And how would you rate the hands-on opportunities that you've been given so far?
I think it depends on what opportunities you want and what you need to consider, I guess, hands on. When emergencies come in, I feel like it's very hands on. I assess the patient. Like if it's a colic, for example, I assess the patient. I pass the tube. I do the catheter. I do the ultrasound. I do the belly tap. I do the rectal. I do all of those things. If it's a laceration, depending on what it is, usually I'm suturing it or most of it, part of it. Um, I feel like they really seek out hands-on opportunities for me. And so some of the doctors have personal, like retired horses, so they bring them in. I get to do joint injections. They'll let me pick what I want to do. So, like, do you want to do an SI or do you want to do neck injections? And I've given those opportunities. So, I've done a fair amount of joint injections. I feel pretty good as far as ultrasounds considered. During surgery, if we have a castration, I get to do a large part of that. So I feel pretty happy overall with the hands-on opportunities.
And how would you evaluate the mentorship?
I think it's really good. And I think it's anywhere you go, it's kind of what you seek out. And so I'm technically given a veterinary mentor here who's Dr. Bolam, who's also a Canadian. And, she's been really good. And she also helps to give me these opportunities. And then something else they do for mentorship now that we're kind of in this slower time of year is they've made these intern short courses. So each doctor kind of picks what their specialty is. And then I spend some time with them and they kind of teach me what they think is really important for me to know. And so I've done like ultrasound courses. We have a doctor here who's really into advanced dentistry. And so, we might spend a day doing like tooth extractions or advanced, cavities, like, things like that. So
Okay.
it's been really good.
Cool. And what would you say has been the biggest challenge so far?
I think the biggest challenge is probably what everybody's going to say. The hours worked is very hard. And I think it's really hard to be up at night, be up during the day. So that's always a challenge. And I think I have a unique challenge for this internship as far as they had 2 interns last year, and then this year it's just me. And so it's been a challenge as far as kind of changing the internship to be a one-person internship. But it's been good because they've really personalized it, and there's no set in stone rules, and they've kind of made some good changes as it's gone along. So I think it's hard being the only intern, but I think there's a lot of benefits because any opportunity there is, it's my opportunity. So if there's an opportunity for joint injections, I know it's going to be me, and I don't have to compete with someone else to get that.
Yeah. Cool. Well, thank you very much, Dr. Cates. I appreciate you sitting
Sure.
down with me.
Yeah.
If you guys have any more questions about the internship, you can check out their website, or you can check out my blog, jeremyshaba.com, for more interviews with other interns. Thanks a lot.
Awesome. Thanks.